Washington and Oregon share more than a border. What happens in one state often reflects in the other, and Wednesday's COVID-19 update was no exception.
Fortunately, we're not done with COVID-19 yet, but we are closer to normality than ever.
That was from Oregon Health Authority, and from the Washington Department of Health.
Transition away from the initial pandemic response to learning to live with COVID.
Both states said cases are trending up as people gather again and ditch the masks, but hospitalizations are not increasing drastically.
It means that we have good capacity in our healthcare system.
Experts credit high immunity, above 80%, with most people vaccinated with at least one dose.
They do wear off over time.
Because of that, breakthrough cases are rising, and health officials encouraged people to get boosted.
If it's been more than 4 months, it's time to consider getting an additional dose.
Wastewater testing shows the virus is circulating.
I think you can take it as a given that there's a lot of COVID-19 out there. If you're in a crowded setting, you're going to be exposed to the virus.
The BA2 subvariant is the dominant strain.
90+%.
More contagious, but usually less severe. In Oregon, the average weekly reported case numbers have risen to more than 600, up from a couple hundred a few weeks ago. Because of unreported at-home testing, OHA says those numbers could be 5 to 10 times higher. But the good news is those cases are mild. COVID hospitalizations remain below 150 statewide.
The most recent model projects a slight increase in hospitalizations over the next 2 months.
Even with mask mandates ending in most places, medical experts from both states said it's best to keep wearing masks to prevent infection, especially in crowded areas. But as long as hospital numbers remain reasonable, renewed mandates are not on the table.
Right now, there are no plans to do that.
2 states sharing a border and a message.